Come with your tea or coffee and let us try to understand beta blockers. When I was researching about the mechanism of action, I have found this figure that is showing us that beta blockers bind to beta-adrenergic receptors and thereby block the binding of norepinephrine and epinephrine to these receptors. In fact, there are three classes of beta blockers. First class are non-selective beta blockers which block both beta-1 and beta-2 adrenergic receptors, and they are propranolol, nadolol, pindolol, timolol, sotalol, carvedilol, and labetalol. The second class of beta blockers are more cardioselective because they are little selective of beta-1 adrenergic receptors, and this eliminates the unwanted bronchoconstrictor effects of the non-selective beta blockers. And these drugs are useful for hypertensive patients with impaired pulmonary cardiac function and also in diabetic hypertensive patients. The drugs in this group are metoprolol, betaxolol, atenolol, esmolol, bisoprolol, acebutolol, and nebivolol. And the last class of beta blockers are drugs that possess vasodilator actions through the blockade of vascular alpha-1 adrenergic receptors, and they are labetalol and carvedilol. Labetalol is useful for treating elderly and black hypertensive patients, also pregnancy-induced hypertension and hypertensive emergencies. There are two drugs that I want to mention them separately, and they are pindolol and acebutolol. These drugs have intrinsic sympathomimetic activity because they weakly stimulate beta-adrenergic receptors, and this minimizes the disturbances of carbohydrate and lipid metabolism. These drugs are effective in hypertensive patients with moderate bradycardia and also in diabetic hypertensive patients. Apart from hypertension, beta blockers are used for angina, myocardial infarctions, arrhythmia, glaucoma, hyperthyroidism, heart failure, and also migraine. Side effects seen with beta blockers include bradycardia, bronchoconstriction, metabolic disturbances, and also CNS related effects. Thank you for watching. See you later.